What is the correct angle for intramuscular injection administration in the deltoid? A. 15 degrees. B. 45 degrees. C. 90 degrees. D. 25 degrees. Answer, C. Intramuscular injections are typically given at a 90-degree angle to ensure the medication reaches the muscle layer. A CCMA should identify that chain of custody is used for which of the following? A. Urinalysis. B. Drug screening. C. Blood glucose. D. Lipid panel. Answer, B. Chain of custody ensures specimen integrity and is mandatory for drug testing. Which of the following blood pressure readings indicates stage 2 hypertension? A. 130 to 80 mmHg. B. 120/78 mmHg. C. 142/92 mmHg. D. 138 to 84 mmHg. Answer, C. A systolic pressure greater than or equal to 140 or diastolic greater than or equal to 90 mm of mercury indicates stage 2 hypertension. Which of the following terms refers to a surgical opening in the colon? A. Nephrostomy. B. Colostomy. C. Tracheostomy. D. Gastrectomy. Answer, B. A colostomy is a surgical opening made in the colon to divert feces. When preparing a patient for Holter monitoring, where should the electrodes be placed? A. Arms and legs. B. Neck and back. C. Chest. D. Abdomen. Answer, C. Holter monitor electrodes are placed on the chest to record heart activity. Which of the following is considered a CLIA wave test? A. Urine drug screen. B. CBC. C. Pap smear. D. Blood culture. Answer, A. CLIA wave tests are simple and low risk, such as urine drug screens. What is the first step a CCMA should take if a patient faints during a venipuncture? A. Call 911. B. Elevate the patient's legs. C. Offer water. D. Document the incident. Answer, B. Elevating the legs helps restore blood flow to the brain after syncope. Which term means slow heart rate? A. Tachycardia. B. Bradycardia. C. Arrhythmia. D. Fibrillation. Answer, B. Bradycardia is defined as a heart rate below 60 beats per minute. A CCMA is reinforcing teaching with a patient who has a new prescription for an enteric-coated tablet. What should the CCMA say? A. Crush the tablet before swallowing. B. Take with milk. C. Swallow whole with water. D. Dissolve under the tongue. Answer, C. Enteric-coated tablets should not be crushed and must be swallowed whole. Which PPE is required when assisting with wound irrigation? A. Gloves and mask only. B. Gloves, gown, mask, face shield. C. Gloves and gown only. D. Mask and face shield only. Answer, B. Full PPE is needed due to risk of splash during wound irrigation. Which organ is primarily responsible for filtering blood and forming urine? A. Liver. B. Bladder. C. Kidney. D. Pancreas. Answer, C. The kidneys filter blood and produce urine. Which of the following types of scheduling allows for patients to be seen in the order they arrive? A. Stream scheduling. B. Double booking. C. Open hours. D. Wave scheduling. Answer, C. Open hours scheduling allows patients to arrive at any time. What is the minimum number of identifiers required before administering medication? A. 1. B. 2. C. 3. D. 4. Answer, B. At least 2 identifiers, e.g., name and DOB, are required. What does the suffix algia mean? A. Inflammation. B. Disease. C. Pain. D. Study of. Answer, C. The suffix algia refers to pain. A CCMA measures an infant's head circumference. Where is the tape placed? A. Across the neck. B. Over the eyebrows and around the occipital bone. C. Around the chin. D. Below the ears. Answer, B. Head circumference is measured just above the eyebrows and around the back of the head. What action should a CCMA take when sanitizing instruments? A. Use bleach solution. B. Use dry heat. C. Use ultrasonic cleaner. D. Soak in alcohol overnight. Answer, C. Ultrasonic cleaners are used to sanitize delicate instruments effectively. Which laboratory department processes a hemoglobin A1C test? A. Chemistry. B. Hematology. C. Microbiology. D. Cytology. Answer, A. A1C is processed in the chemistry department to assess glucose control. What is the normal adult respiratory rate? A. 8 to 12 bpm. B. 12 to 20 bpm. C. 20 to 30 bpm. D. 25 to 40 bpm. Answer, B. A normal adult respiratory rate is between 12 and 20 breaths per minute. Which position is best for a patient experiencing shortness of breath? A. Prone. B. Sims. C. Fowler's. D. Supine. Answer, C. Fowler's position promotes lung expansion and eases breathing. A CCMA notes a large hematoma developing after venipuncture. What should be done? A. Apply ice and pressure. B. Massage the site. C. Elevate the arm only. D. Ignore unless bleeding. Answer, A. Immediate pressure and ice help reduce hematoma development. Which term describes difficulty swallowing? A. Dysuria. B. Dysphagia. C. Dyspnea. D. Dysplasia. Answer, B. Dysphagia refers to difficulty swallowing. What method should be used to clean the skin before a blood culture? A. Soap and water. B. Alcohol only. C. Iodine followed by alcohol. D. Chlorhexidine. Answer, D. Chlorhexidine is preferred for blood cultures due to its strong antiseptic effect. Which pulse site is located at the wrist? A. Apical. B. Temporal. C. Brachial. D. Radial. Answer, D. The radial pulse is found at the wrist, near the thumb. What abbreviation indicates a prescription to be taken before meals? A. BID. B. AC. C. PRN. D. PC. Answer, B. AC stands for anti-sebum, or before meals. What does the term asepsis mean? A. Sterile technique. B. Clean technique. C. Absence of pathogens. D. Complete disinfection. Answer, C. Asepsis means the absence of disease-causing organisms. Which of the following ECG waves represents atrial depolarization? A. P wave. B. QRS complex. C. T wave. D. U wave. Answer, A. The P wave reflects the electrical activity of the atria. What is the primary purpose of OSHA in healthcare settings? A. Control billing practices. B. Enforce infection control. C. Protect workers' safety. D. Monitor medical licensing. Answer, C. OSHA ensures employee safety through workplace regulations. How should a CCMA dispose of a needle after an injection? A. Recap and throw away. B. Place in a sharps container. C. Place in the trash. D. Leave on tray for cleaning staff. Answer, B. All needles must be disposed of immediately in a sharps container. Which color tube is used for a CBC test? A. Light blue. B. Red. C. Green. D. Lavender. Answer, D. D. The lavender tube contains EDTA, which prevents clotting for CBC tests. When obtaining a medical history, what is the first step a CCMA should take? A. Ask about insurance. B. Identify the patient. C. Confirm appointment time. D. Begin chief complaint. Answer: B. Proper patient identification is the priority before collecting any medical information.